Welcome to Roadmap to Residency. Hello everyone, I'm Aviraz. Welcome to our video on ovarian tumors. So, which germ cell layer is primarily responsible for the development of mature cystic teratomas? So a 24-year-old woman presents with a lower abdominal pain and discomfort. Imaging studies reveal a cystic mass in the right ovary, and surgical removal confirms the diagnosis of mature cystic teratoma. Histological examination shows a cystic structure containing hair, sebaceous gland, and teeth. Which germ cell layer is primarily responsible for the development of mature cystic teratoma? Ectoderm, mesoderm, endoderm, trophoblast, or neural crest cells. So ectoderm, so mature cystic teratomas are germ cell tumors that arise from the totipotent germ cells. The cells within these tumors can differentiate into tissues derived from any of the three germ cell layer. However, ectodermal tissues are commonly presented in mature cystic teratomas. The cystic structure often contains a hair, sebaceous material, and teeth, which are derived from the ectodermal elements. So which is the most likely diagnosis? 35-year-old woman undergoes abdominal imaging for chronic abdominal pain and a large cystic mass is identified in her ovary. Surgical exploration reveals a unilocular cyst filled with thick gelatinous mucinous fluid. Microscopic examination of the cyst wall shows a single layer of tall columnar cells with basal nuclei and abundant apical mucin. What is the most likely diagnosis? Ovarian fibroma, ovarian serous cystadenoma, ovarian mucinous cystadenoma, ovarian teratoma, and ovarian dysgerminoma. So ovarian mucinous cystadenoma is the described findings, including a large cyst mass in the ovary filled with thick gelatinous mucinous fluid and microscopic examination showing a single layer of tall columnar cells with basal nuclei and abundant apical mucin are characteristic of an ovarian mucinous cystadenoma. These tumors are benign neoplasm that typically present as large cystic masses containing the mucin secreting cells lining the cyst wall. So ovarian tumors, the most common adolescent mass in females more than 55 years old, present with abdominal distension, bowel obstruction, and pleural effusion. There is risk increased with advancing age, increased number of lifetime ovulation, for example, early menarche and late menopause, nulliparity, endometriosis, genetic predisposition like BRCA1 and BRCA2 mutation. The risk is decreased with previous pregnancies, history of breastfeeding, OCPs, or tubal ligation. Epithelial tumors are typically serous or mucinous. Monitor the response to therapy or relapse by measuring the carcinoma or CA125 levels, which is not good for screening though. The germ cell tumors can differentiate into somatic structures or can remain undifferentiated. The sex cord stromal tumors develop from the embryonic sex cord and stromal derivatives. So surface epithelium, they all form the epithelial tumor. If it is from the egg, it forms the germ cell tumor. If the origin is from the follicle or cortex, it forms the sex cord stromal tumor. So ovarian tumors. So number one is serous cystadenoma, which is a benign and most common ovarian neoplasm and lined by fallopian tube-like epithelium. The mucinous cystadenoma is benign, multiloculated, large, and is lined by a mucinous secreting epithelium. Here you can see now this is the mucinous secreting epithelium. Brain tumor is usually benign and behaves like a nest of urethelial like a bladder-like epithelium with coffee bean nuclei. The serous carcinoma is the most common malignant ovarian neoplasm and it shows the samoma bodies. Mucinous carcinoma are malignant, rare, and may be metastatic from appendiceal or other GI tumors. The mature cystic teratoma, you can see in this figure containing the sebaceous material, hair, and teeth. And this is a very typical feature of mature cystic teratoma. It can contain the structures derived from all the three germ layers. Immature teratoma are the malignant, aggressive, and it contains the fetal tissue and neuroectoderm. Dysgerminoma is a malignant, most common in adolescent and equivalent to the male seminoma, but rarer. It concerns a seat of fried egg appearance. So you can see is fried egg appearance. This is one egg. This is another egg. This is another egg. Fried egg, fried egg, fried egg. So this is just a seat of fried egg tumor. So York sac tumor, also called as the endodermal sinus tumor, that may be there, which can be malignant or aggressive. It shows a yellow friable hemorrhagic mass and there is appearance of a glomerulus like a structure. Here you can see this looks like a glomerulus, and then this is the specimen of the ovary, then it is a dysgerminoma. The Yorkshire tumor is also called as the endodermal sinus tumor, a tumor which resembles the cellular dual bodies. 25-year-old woman presents with pelvic pain and abdominal mass. Imaging studies reveal a complex ovarian mass with areas of cystic and solid components. Lab studies shows an elevated serum alpha fetoprotein level. Surgical exploration confirms the presence of a tumor in the ovary. Microscopy reveals a cellular dual bodies. What is the most likely diagnosis? We have all talked it earlier. So the diagnosis ovarian York sac tumor. So what is the following, which of the following is the most likely diagnosis for this clinical presentation? 45-year-old woman presents with abdominal distension and discomfort. Imaging studies reveal a large ovarian mass, and further investigation demonstrate the presence of ascites. Additionally, pleural effusion is noted on the chest imaging, where the patient undergoes surgical resection of the ovarian mass, which is found to be a benign tumor. So what is the diagnosis of this patient's current clinical presentation? So mixed syndrome is characterized by the triad of benign ovarian tumor, ascites, and pleural effusion. So a mixed syndrome triad of benign ovarian tumor, ascites, and pleural effusion. Diagnosis of exclusion. Treatment is with thoracentesis or paracentesis, unilateral salpingo oophorectomy, and a wedge resection. Thank you for watching. Keep studying hard.